Good morning, all. Good morning. Can you hear me? Okay. Can we start the class? Do you have any doubt in last class, like antenatal? No doubt. So did you watch the complete videos? Did you watch the complete video? Okay. Did you go through the case scenario? Okay, I hope like you would have gone through the case scenario. So last 15 minutes we'll have a discussion on the case scenario. Okay, so before that we'll just see the small topic. 1 minute. Okay. So sorry. So last 15 minutes we'll have the case scenario discussion. Okay. So now we will just see the small topic of our role in labor. So already we have seen this during the antenatal classes. So in women's health, most of the things will be overlapping. So today, like since we have seen all these things in detail in during the antenatal class, I'm not going to give you much stress over that, but I'll just brief out certain things which we can do during the labor. So our role in labor is mainly to reduce pain. Reduce pain means we cannot completely reduce the pain because definitely during normal delivery they are going to have the pain. They will be having the contractions and they will be having the pain. But our main idea is to reduce their discomfort, or you can say like we can make their delivery little bit easy. We teach them certain techniques to reduce the discomfort and reduce their difficulties. So that is our main role. Like medicine, completely we will not be able to reduce the pain, but to a certain extent we can make them comfortable and make their delivery very easy one. Is that clear? So during this labor, I know, like I hope you all know that labor will be divided into stages. It will not. It is not as just sudden onset, just like that. It will be going gradually, or in other words, we can say it will be progressing gradually. So when it is progressing, it is divided into three stages: stage one, stage two, and stage three. So stage one, again, it is divided into three phases depending on the effacement that is taking place. In stage 2 is the active labor, where the baby will be descending down and it will be coming out. And stage 3 will be the passive one, where the residuals will be coming out. So that is just a passive one. So in the first two, stage 1 will be there for a very long time, especially for the primary gravid mothers. It will sometimes it may go till 2 days or 3 days. So that will be just keep on dragging. So that is the most difficult part, because uh, they will be having pain on and off. They will not be able to concentrate in other things, and they will be feeling as if like let it end, but it will be just progressing. Okay, so that's why it takes longer time, and the mother will feel a lot of discomforts during first stage. And in the second stage, it will be the pain will be much higher, but the duration will be little shorter. Okay, so in that way, it will be little better for the mother. Exactly. At stage 3, there won't be much of pain. So that's why we have a lot of, we will put a lot of efforts during the first stage. And second stage, our aim is to help them to deliver the baby. And third stage, we don't have much of the issue. So these are some of the coping up strategies. The first thing is relaxation technique. So you need to make them feel what is relaxation, and you need to make them to understand the difference between relaxation and the tension, because most of the time the mothers will not feel what is relaxation and what is tension. So that's why you need to make them understand that. You need to make them practice that from beginning. So from beginning means like from the antenatal class itself, you need to make them practice the relaxation technique, so that they will be able to use it during the labor. Is that clear? So here, this relaxation technique will help the mother to reduce their tiredness. Okay, so sometimes they may just give away, because it will be keep dragging. The mother may just give away, and they might feel, okay, somehow I just want to end this, like that. So many of the women, especially nowadays, they just go into cesarean section just to just that they cannot cope up with this first stage and first stage. Okay, so they just want to end immediately, so they go for a cesarean section. Okay, so in this relaxation, there are 4 techniques. One is Michelin's technique, Jacobson's technique, touch relaxation, that is you have a massage, then imaginary method or visualization imaginary method. Okay, so in this Michelin's we will be teaching them the counterbalancing. So here in the Michelin's, we will be going from proximal to distal. So from proximal to distal, we will make the muscle to contract. We will make the opposite muscle to contract, then relax. So here, like in Michelin's, what we do is we ask the person to contract the opposite muscle group, so that the agonistic muscle group will be relaxing. So what we have to do, like we know the posture of a pregnant mother. So they will be having rounded shoulders. They will be having hyperextension, like increased lordosis, increased kyphosis, like that. The shoulder will be internally rotated. So we know the posture of the pregnant women. So what we do was you need to make the mother to do the opposite. So since the hands will be in internal rotation, you make them to do external rotation of the shoulder. So when you do external rotation, automatically the internal rotators will relax. So like that, so you have to give the opposite movement of the pregnant women posture. So this will help them to relax their muscles. So this is your Michelin's method. So I'll show you the video. Okay, so Michelin's will be starting from proximal to distal. Okay, so in the other hand, Jacobson's will be from distal to proximal. So here in Jacobson's, what you do is you contract the affected muscle. That means if the mother is having tightness in the elbow flexion, you make them to do further elbow flexion and relax the muscle. So this is your Jacobson's method. It uses the inhibition technique. So Jacobson's will be going from distal to proximal, and it will be using the agonistic muscle. So you contract the agonistic muscle so that it relaxes. So that is your Jacobson's method. So this two, they will be able to do this two in the first stage or in the first phase or second phase. But later on, they will not be able to do when the pain progresses. So that's why you need to go for the other techniques. So other technique which will be helpful for a pregnant mother is touch relaxation. That is your massage. So not all the techniques you are going to use it. You're going to use stroking, effleurage, and circular kneading. So these are the three techniques you are going to use. These three techniques will help the mother to relax herself. So this one you need to teach the partner to do. So as we have seen earlier, in the first stage, the pain will be from T11 to L1. So you need to concentrate in the like lower thoracic region. Then in the second stage, the pain will be in the lumbar region. So you have to concentrate in the lumbar region from T12 to S2. So in the back, you can go for stroking from proximal to distal, then effleurage from distal to proximal, then you can go for circular kneading. So you can use a tennis ball to give circular kneading to give a continuous circular movement. Okay, then you can also go for massage over the abdomen, especially in the second stage. So there you have to go for lateral stroking, then you can go for stroking and mild effleurage over the abdomen. So the pressure should be little less compared to the back. So this is for the touch relaxation. Then imaginary method, it is a visualized imaginary method, or you can also say that as suggestion method. So during the history taking, you would have asked the mother about their hobbies or about their happy moments like that. So with the help of those details, you can make them to imagine their happy moments again. So maybe like if they say that their happy moments were uh, they went to Cameroon for with their husband. So what you can do was you can ask them to close their eyes and sit. Then slowly you can start to talk. Okay, so now like you're walking in the tea estates in Cameroon. So can you feel the cool breeze? Okay, so breathe in the cool breeze, then breathe out like that. So you have to keep talking about their happy moments and imaginary bring their happy moments in their mind. So once their mind is occupied by the happy moments, they will get deviated and they will get relaxed. So this is the imaginary technique. So I have the video for this. Okay, so after the class, you can watch the video for all the relaxation technique. So I have not gone into so depth because already you have learned all these things in your exercise therapy. So I hope like if you want again in depth, you can tell me. You can watch the video also, that will be helping you to recollect your technique. So next is breathing technique. So in breathing technique, you have three phases in the stage one. So for that, you have different types of breathing. Then in the stage two, you will be doing a breath holding and push down breathing. Okay, so that is another breathing type. So in the first stage, the first will be like de-stressing breathing, or you can also say that as focused breathing, where you need to help them to focus on any object or anything, and you have to reduce the hyperventilation. So you are going to pace with the contraction. So this also we have seen last class. So I'm not going again in that. Then in the second phase, you need to add up little ha-ha sound. Whenever you're doing inspiration, you have, whenever you're doing expiration, you will be doing expiration with this ha. Okay, so this again is to phase your breathing technique along with the contraction. Not only that, it will be helping you to reduce your respiratory rate so that you don't go for hyperventilation. because normally whenever you have pain, you will be going for hyperventilation or you will be going for breath holding. So to reduce those two, we are going to use this technique. Then the third phase, again you are going to add another vocal sound called he. That is, during inspiration you will add this sound as he. This again is because the pain will be little bit higher, so to focus other than the pain, or to focus outside the pain, you are going to add up all these vocals. So when they do this vocals, it will be helping them a lot to reduce their stress. Okay, so during inspiration you need to make them to do along with the he sound, hissing sound, like that. So he, ha ha. So this will help them to face the contraction. So again, once again, at the beginning and the end of the contraction, you need to do a cleansing breath. Okay, so for all these things, we have already sent you the video. You just watch the video, and if there is any doubt, you just please come out. Then in the second stage, this second stage is the J breathing, where you will be breathing in, then you will be hold and push down the baby. Then you have to breathe out in such a way that you are going to um, breathe through the birth canal. Okay, so that is called J breathing. So you breathe in, hold and push down the baby, then breathe out in such a way that you are pushing the baby inside the birth canal. So that is called as J breathing. So again, here this breathing is also will help you to reduce hyperventilation and will help you to increase the push down the baby. Okay, so these are the different types of breathing exercise we are going to teach them during the labor. So this one you cannot just teach them on the day of labor or in the labor table, because they will not be able to concentrate. So that's why you need to stress all these things in the antenatal classes, so that they practice before itself, then they make use of it during the labor. So directly, if you on the table, if you go and teach, it won't be effective at all. The mothers will not be able to do the technique. Okay. Next is like positioning. So positioning, if you see, in the first stage, you will be going for a counterbalancing, counter gravity position. In the second stage, you will be going for an upright position, so that the gravity will be giving a push towards the baby or giving a pull towards the baby, and the baby will be helping you to the gravity will help you to descend the baby. So in the first phase, like the mother will be very relaxed, and the mother will be allowed to walk around freely, move around freely. Maybe at the end of the second phase only, the mother will be bound to bed. Otherwise, the mother can walk, do their activities freely. Okay, so these are the positions which you will be following. So here, if you see this relaxed standing, or you can say stoop standing, this position will help the mothers to reduce the pressure over the pelvis, and that will help you to reduce the pain. So these are the position for first stage of labor, and this two position you have to avoid if they have symphysis pubis dysfunction. So if they have symphysis pubis dysfunction, when they do abduction, it will be increasing the pain. So that's why you have to avoid this two position. Okay, so these are some of the position for stage 1. So this will be mainly upright position and counterbalancing like gravity. That's why they go for a stoop one, so that the gravity will not directly pull the baby. So if the gravity is pulling down the baby, it will be putting a lot of pressure over the cervix, and the effacement will not be complete. So that's why you need to avoid the pressure over the cervix. Then, so these are some more position for first stage of labor. Okay. Then this is the second stage labor position. So this will be squatting, kneeling, and sitting, all those things, which everything will be towards the gravity and towards gravity position. Now, if you see, the effacement will be complete. The complete 10 centimeter effacement will be there. So even if the gravity is pulling down the baby, then it will be more useful. That's why you go for these kind of positions in the second stage. So not only that, this squatting, this sitting will help to increase, will help to increase the pelvic cavity region. So the size of the pelvic cavity also will increase when you are positioning them in these positions. So that's why, like, this question will help them to go for a easy labor in the second stage. But unfortunately, in Asian countries, they mostly they don't allow them to go for different position, because these positions will not help. Will have some disadvantages, like the doctors will find it difficult for them to monitor. So that's why they will be putting the mothers in the Fowler's position, which will be in a eliminating gravity position, where gravity will not be able to act much. But nowadays there is a lot of awareness about the different positions, and they still try. Okay, but that is not in old schools kind of treatment. Most of the time they do not go for this different positions. Okay, but Western countries follow all these kind of positions, and they do delivery in different positions. So these are some more positions for second stage of labor. So you can, in this picture, you can see in this counterbalancing position, it will be a little difficult for the mother to push, where the gravity will not give any pull. Can you see the baby's head and the position of the baby? So the gravity will be acting this manner, and the baby has to come in the eliminating gravity position. But if you see here, the mother is totally towards gravity, so the gravity will be acting giving a good pull in this position, in this position. Okay, so that's why squatting will be more effective in the second stage. Okay, so these are some of the side lying positions, like where you can teach the partner to go for this kind of positions. Because can you see it little clear why they want to go for each position? Okay, so the advantage of each position is given here. So you can explain these things to the partner, and you can make them understand the need of this kind of position. So without the partner's help, they may not be able to do any of the positions, and they may not be able to comfort the mother. Okay, so in OSPI, so the questions will be like, what are the the mother is in stage 1 labor or phase 1 labor. So what are the PT, as a PT, how you will be able to help the mother to reduce the discomfort? These kind of questions will be there. So you need to teach what kind of breathing exercise you will do, what kind of positions you will teach them, and what kind of massage you will give. All those things you have to teach. Is that clear? So that is how the questions, the OSPI questions will be. Okay. Next is massage. So as we know, so we can go for stroking, effleurage, and kneading. So for kneading, you can use single hand or double hand, and you can also use a tennis ball, which will be more useful, because sometimes the partners may have a rough hand, or sometimes they may have any like scar or anything, so which may affect their massage, or which may affect the smoothness of massage. So you can ask them to do using a tennis ball, which will be more relaxing to the mother. So these are the area of pain during the first stage. So from T11 to L1, so you can ask them to give massage over this. So stroking will be given from proximal to distal. Effleurage will be given from lower to upper like this in the sidewards. Then you can also go for circular kneading like this. Okay. So this is for stroking and effleurage. Then massage for the abdomen is very light stroking, which will be just giving them a soothing effect. Okay, so you can do massage like over the abdomen. You can do massage over this area. So in the lateral stroking, and this is double hand kneading. So the pressure should be very mild. It is just given to relax the abdomen muscle. So you can also do massage over the legs, especially when they have severe pain. They might have cramps and other thing in the lower legs. So you can ask them to, you can teach them picking up, bringing, then stroking, circular kneading, effleurage, all those things you can teach them. So this will help them to reduce the cramps. Okay. So perineal massage, I will teach you with a video. So perineal massage is normally done by the doctors. So when they feel the pressure is more in the birth, like in the perineal region, when the baby's head is coming down, so they will be doing this perineal massage to reduce the tension and to reduce the episiotomy tear. So normally sometimes the tear will be very big and huge. So to avoid that, or to avoid the rupture of the perineal region, they go for this massage. So especially here they do a friction kind of massage. So circular friction or transverse friction is done to reduce the tension over the perineal region. So doctors or midwives or any other like medical persons will be doing this perineal massage. So as a PT, if you are there in the labor room, then you can do this. Then next is like we can give TENS. So TENS can be given, like you can teach them how to increase and reduce the tension, friction intensity in the TENS. So you can use bus TENS or brief TENS. So normally the pocket TENS will be used by and they will be fixing the path. You have to fix the paths and connect and give the mother the TENS unit. So the mother, whenever she has pain, she is not able to tolerate pain, she will increase the intensity and reduce it. Okay, so the placement of electrodes will be in the first stage. The pain will be from T11 to L1. So you need to place the TENS in the T11 to T12 region. Okay, so that is in the first stage. In the second stage, when the pain is more intense, then you will be placing one TENS in L1 to L2 region. The another set will be at S2 to S4 region. Okay, so you can also place one TENS in T10 to L1 region. Then another pad will be in S2 to S4 region, because the more severe pain will be there in the second stage, and the pain will be in this region. That is in the lumbar and the sacral region, you will have more pain. So that's why you can place the TENS over this area. Okay, so in the second stage it will be placed here. In the first stage it will be placed in the T11 to T12. Okay. Then practically you need to consider certain points whenever you are using TENS. So that is like if they are using any pacemaker or anything, then you avoid taking the TENS nearer to the pacemaker, the carotid sinus and other thing, because that will be interacting with a pacemaker or any electronic device. It will be interacting. So you don't fit the TENS nearer to that particular area, especially in the carotid sinus area and in the cardiac area. Then whenever if the mother is planning to go for water bath technique. Nowadays, it is very a famous technique where they will be delivering the baby in the birth pool. So the as we know, the water will give more relaxation and it will help them to reduce the pain and labor it very easily. So that's why they go for this bath pool thing. So when they are entering into the bath pool, you need to remove the electrodes and remove the TENS unit because sometimes they may get electric shock. So you have to remove that. Then you can teach them how to increase and how to reduce properly so that the mother was able to do during the painful area. Then next is like medication. Here medication we don't have much role. So in the antenatal class you will be teaching about the medications that is used and what are their side effects and what is the best medication. But during the labor we don't have any role in the medication. So during antenatal class, you can teach them these are the medications available and these are their side effects. So whenever like they can opt for certain kind of medication. But this too, since the pethidine and Endonox has the side effects like uh, leading to nausea and vomiting of the mother. Sometimes they may find it very difficult to cope up with the progression of the labor. Sometimes they will become more stressful and sorry, sometimes the medicine will go for sedation and the mother will not be able to progress the labor. So that's why nowadays they avoid these two medicines and they go for epidural anesthesia. So epidural anesthesia is done intravenous infusion through lumbar puncture. So they will put a small punch at the L1 region, then they just connect it to a small tube. So that tube will be connected to the intravenous pump where the medicine is given in a meter dose. Meter dose means per hour this many drops like that. So it will be given like a meter dose. Since it is a low dose, there won't be any problem with mobility. There won't be any problem with the sedation. The mother will be fully conscious and the mother will be able to give birth the baby. She will be full alert to welcome her baby. Okay. Then, so these are the advantage of this epidurals. So that's why nowadays many of the women prefer this epidural anesthesia. So these two things regarding the medicines you need to teach during the antenatal time. Okay, so this is the overall our role in the labor. Okay. So now you can watch a video on relaxation technique. Then breathing technique already we have seen. Okay, so all other techniques, all other strategies we have already seen in the antenatal class. So I'll just show you video regarding the relaxation technique. Okay. So what class you have next?
So hi, this is Allison Abizaid with Health Forward Wellness Center, and what we're going to go over right now is another relaxation technique called a muscle reduction relaxation. So what we're basically going to be doing is we're going to be tensing and releasing the muscles in order to create a form of relaxation for the body to experience. And this helps in a lot of medical conditions, including high blood pressure, when it's practiced on a regular basis. So what we're going to do is we're going to start with her feet, and we're going to have Kitty point and flex her feet. Okay, so Kitty, if you wouldn't mind pointing and flexing your feet from your ankles, there you go, just pointing all the way down and flexing all the way up. You see how the tension, how she's got a lot of tension in her feet right now. And now what I'm going to do is ask her just to relax. Just relax your toes and relax your feet. Good. Now the next thing we're going to do is go ahead and start tensing your muscles in your legs. Tense them really tight and hold it for about 5 seconds, and then go ahead and release. Good, excellent. The next thing we're going to do is we're going to come right up here to her buttocks, and I'm going to ask her, go ahead and squeeze your buttocks. Squeeze, squeeze, squeeze as tight as you can, and slowly release. Good, and each time that she's releasing, her body is going to be experiencing a form of relaxation. Now I realize that I'm going through her different body parts fairly quickly because this is a demonstration, but when you're at home and you're doing this, take the time that you need, hold it for 5 to 10 seconds, and then go ahead and release after that. The next part of the body we're going to go to is her stomach. Go ahead and suck your stomach all the way in. There you go. Good. Feel that belly button go all the way down to the small of the back, and slowly release. Excellent. And feel now the tension in your chest. Go ahead and tense your chest up. Good. And raise the shoulders up to the ears all at the same time. And relax. Good. Breathing out. Excellent. Take a deep breath in and go ahead and tense the muscles on your arms. Make them nice and strong and straight. Squeeze the hands and the wrists. Good. And exhale and relax. Go ahead into the shoulders and into the neck. Bring the shoulders up. Go ahead and tense the neck all the way up. Good. Take a deep breath in. You're tense, tense, tense. And slowly relax as you breathe out. Good. Now with the facial muscles, go ahead and just squint your face up. Make all those funny looks that we all make. Just make sure that you're all squinched up and your muscles on your face are all tight. There you go. Good. And now slowly relax as you breathe out. Good. Excellent. So this is just a demonstration of the muscle relaxation technique.
To watch the other segments in this video series or for how-to videos on...
Okay, so this is our Jacobson's technique. So which will be done from distal to proximal. Okay, so the next technique. So the next is Michelin's technique of relaxation. which will be done from proximal to distal.
This is the Mitchell method of physiological relaxation. Lie on your back with the pillow under your head and your hands resting on your tummy. Pull your shoulders towards your feet, away from your ears, making the neck longer. Stop. Register or feel that your shoulders are lower down and there is now a wider space between them and your ears. Move your elbows out and open. Keep your arms supported on the bed. Stop. Feel the position of your arms and elbows and the pressure of your arms on their support. Move your fingers and thumbs long and supported. Open out your fingers and thumbs, keeping your wrists resting on their support. Stop. Feel your fingers and thumbs fall back into their support on your tummy. Don't let your hands touch each other. Turn your hips outward. Feel your thighs and lower legs roll outward. Stop. Feel your legs turn outward. If you wish, move your knees gently until comfortable. Stop. Feel the resulting comfort in your knees. Pull your feet away from your face. Bend at the ankles, gently pointing your toes. Stop. When you stop, the muscles on the back of your legs relax. Feel the results. Press your body into the bed. Stop. Feel the pressure of your body on the support. Press your head into the pillow. Feel the movement in your neck as you do this. Stop. Feel the weight of your head lying in the hollow space you have made for it. Take a deep breath, expanding forward slightly above the waist and around the lower ribs. Then breathe out easily. Repeat one more time. Draw the jaw down. Avoid opening your mouth. Stop. Feel your separated teeth and the smooth skin over your cheeks. Especially, feel your lips gently touching each other. If it is stuck against the roof of your mouth, bring your tongue down and let it lie in the middle of your mouth. Stop. Feel the tips of your tongue touching your lower teeth. If your eyes have not already closed, close your eyes. Stop. Be aware of the darkness you have produced when your eyes are at rest. Make the space between your eyebrows and your hairline as wide and wrinkle-free as possible. Try not to frown. Smooth the skin over your forehead, from your eyebrows to your hair. Continue with the movement over the top of your head and down the back of your neck. Stop. To return to full activity, stretch your limbs in any direction. Do not hurry. Sit up slowly. And wait a minute before standing up. You have now completed the whole sequence. Continue working in the same order through the entire cycle, again and again, using the original phrases and explanations associated with each part. Thank you.
Begin by allowing your body to get more comfortable wherever you are right now. Take some full, slow breaths in through your nose and out through your mouth. Allow any distracting thoughts to come and go as if you're watching them floating down a stream, and guide your attention back to your slow and easy breathing. When you're ready, breathe in and make a tight fist with your right hand. Hold and focus on what that tension feels like to you. Now, breathe out and release all the tension in the fist. Let your hand become nice and loose. Again, make a tight fist with the right hand and hold it. Then, let the tension and the hand relax fully. Focus on what your hand feels like to you when it is relaxed. Next, slowly breathe in and bring your right forearm up to your shoulder and tighten your upper arm. Hold. Now, breathe out and release. Again, make a muscle with your right arm. Hold and focus on what the tension feels like in your upper arm. Now, breathe out slowly and relax your arm. Breathe in, and now make a tight fist with your left hand. Hold the tension. Exhale and release. Let the tightness and discomfort flow all the way out of your hand. Again, make a tight fist with your left hand and hold. Exhale and release. Breathe in again and bring the left forearm up to your shoulder to make a muscle. Hold and focus on the tension in your arm. Slowly breathe out and release. Notice how that feels. Again, make a muscle with your left arm and hold it there. Now exhale and release. Now take a long breath in and raise your eyebrows as high as they will go. Hold. Exhale and release, letting relaxation smooth across your forehead. Breathe in again and raise your eyebrows as high as they will go. Hold. Release and breathe out slowly. Next, squeeze your eyes tightly shut and make a tight smile. Notice how that tension feels. Breathe out and release, relaxing your eyes and cheeks. Breathe in again and squeeze your eyes closed. Hold. Exhale and release the tension. Now, slowly open your mouth wide and hold it there. Exhale and release. Notice what that feels like to you. Again, open your mouth and hold. Release and breathe out slowly. Next, slowly and carefully pull your head back as though you are looking up at the ceiling. Hold. Exhale and slowly return your head to whatever position is most comfortable to you. Study what that relaxation feels like to you. Again, breathe in and pull your head back slowly. Hold. Exhale and slowly release. Inhale and push your shoulders up towards your ears. Hold them there for a moment. Exhale and release. Let all of the tightness flow completely out of your shoulders. Again, breathe in and bring your shoulders up. Hold them there for a moment. Exhale and release. Let all of the tightness flow completely out of your shoulders. Now, breathe in and push your shoulder blades back, trying to almost touch them together. Hold that tension. Now, exhale, letting your shoulders and chest relax all at once. Again, push your shoulder blades back and your chest forward. Hold. Release and breathe out slowly. Breathe in slowly. And now let your chest and stomach expand all the way, like a balloon filling with air. Hold. Slowly exhale, releasing all the tension from your chest and stomach. Again, breathe in fully and let your stomach and chest push out. Exhale and release. Next, tighten your thighs so that you're pushing yourself up a bit out of your chair and hold. Exhale and release. taking note of what it feels like in your upper legs. Again, tighten up your thighs and hold. Exhale and release. Now, slowly pull the toes on your right foot up toward your shin, stretching your calf muscle. Hold the tension. Exhale and release. Again, pull your toes up, tightening your calf muscle, and hold. And release. And breathe out slowly, noticing what that right foot now feels like to you. Breathe in, and now curl the toes of the right foot downwards and hold that tension. Exhale and release. Again, curl the toes of your right foot downwards and hold. Exhale and release, and study what that feels like. Next, slowly pull the toes on your left foot up toward your shin, stretching your calf muscle. Hold the tension. Exhale and release. Again, slowly pull your toes up, tightening your calf muscle, and hold. Exhale and release. Breathe in, and now curl the toes of the left foot downwards. Hold. Exhale and release. Again, curl the toes of your left foot downwards and hold. Breathe out slowly and release. You have done a great job going through this relaxation exercise. Continue to take some slow, easy breaths. For the next few moments, just notice what your body feels like and enjoy the success you've had in being able to relax your body. Keep that feeling with you throughout the day and remember how good it can feel to be relaxed in your body. Whenever you're ready, take some time to slowly wiggle your muscles around a little. Then, count backwards from 5 to 1 to end this exercise.
Okay, I think you got a clear picture about progressive resisted exercises. So one more video is there. I'll just show the visual relaxation technique alone. Okay, so not all, because like it will take more than 15 minutes. So I'll just show you visualize relaxation technique alone. Okay, I will send that video later. Now, we'll just have 10 more minutes of class. So I'll divide you into two rooms. You can just have a discussion about the last case scenario, what I have sent. Then another 5 minutes for you to present that particular thing. So I will divide into two rooms. I think I can divide you into three rooms, three break rooms. So in three break rooms, you can discuss the case scenario. Then you can select one person. That person can present whatever you have discussed. Okay, so I will display the question. Okay, so you have nearly 10 questions. You have 10 questions. So each group can take up three questions. So like at the end, then you have to discuss this three questions answer. Is that clear? If you're not able to see this, you can take the case scenario from the LMS. Okay, so please join the break rooms. I think you would have completed the discussion. Can we have the first group to present the first 3 questions? Yes, first group. Anyone from first group?
Yes, miss. Okay,
Can you be little louder?
hello.
Yes, tell me. So, can you list down the problems the mother is having along with the reason?
First, the mother might have SI joint dysfunctions because the mother having pains over the posterior pelvis.
Okay.
And then the squish test also be positive on the right side.
Okay. Then,
Okay, then
problem?
poor posture
Okay.
due to because she is having a rounded shoulder with reduced lordosis.
Okay.
Okay, then history of sciatica is it? Because the having pain radiate towards the right side.
Okay.
And then
Any other?
yeah, and then low back pain.
Low back pain. Then, gait. Gait is also abnormal. She's having wandling gait.
Mm.
Maybe because of SI joint problem.
Mm.
So these are the problems the mother is having. So the reason for almost all the problems are mainly like hormonal imbalance. Then, sorry, not a hormonal imbalance, hormonal change. So the smooth muscles will be, there will be like more laxity of the body, the muscles and the joint. That is one reason. Other reason is increase in the abdomen. This also will change the center of gravity, and this will cause the abnormality in the posture and changes in the gait. So that is the other reason for this problem. So the next question, what consideration you would give to alter bladder function symptom the patient is reporting? What advice you will give to change the bladder function, bladder problem?
And perform the pelvic floor muscle exercise.
That means she has frequency of urination. Okay, so they have frequency of urination. That is her. That is her problem. Okay, so for this frequency of urination, you can teach pelvic floor muscle, but that will not reduce the frequency of urination. So the frequency of urination is because the mother is in the 37th week. That means the head of the baby would have come for engagement. So this will be giving pressure over the pelvic muscle. Okay, so that will compress put undue pressure over the pelvic muscle. Then that will compress the bladder. So the bladder capacity is reducing. That's why the mother is having frequency of urination. So by giving pelvic floor muscle exercises, you will be able to increase the muscle power and maintain, reduce incontinence, but you will not be able to reduce the problem. Is that clear? Next question: what physiological changes that happens during pregnancy may lead to this patient's problem? So that one I have already explained in the first question. So the hormonal changes, that is the first reason. Then change in the posture and the gait is because of change in the center of gravity. Okay, due to increase in the abdominal distension, the center of gravity will change and that will lead to the abnormal posture and gait. So you have to explain all these things. Okay, so next group, fourth question.
Hello.
Yeah, tell me.
The question is, do you think her previous history of episodic posterior pelvic pain may be relevant? And we think that yes, is relevant to the episodic posterior pelvic pain.
Okay. Okay, correct. Next question.
Next question, what are these patient functional problems and the advice that could give her to help her overcome them? The first one is prolonged sitting, and for the prolonged sitting, we can advise the pregnant woman to have some walk after the prolonged sitting and have some activities or stretching. And another problem is the pregnant woman driving the children nursery, children out in and out of the car seat, and all the duties involved in childcare. So the advice that can for the pregnant woman is ask her to perform the correct posture, not putting effort at the low back to prevent the low back pain, and the sleep pattern. The pregnant woman complained the sleep disturbance as she is unable to get comfort in bed.
Yes.
Yes, miss.
Okay, so next question. So exercises, what you can give us mainly, you can give pelvic tilting exercises. So that is the main thing for this problem. So the exercises is for the fifth question. Okay, so exercises for the functional problems. So you can give pelvic tilting exercises, isometric back exercises, then posture correction. All those things, ergonomic advices you will be able to reduce this functional problems of the mother. Okay, so next group, seventh question.
Yes, miss. Okay, so number 7 is, what other treatment could you offer her
Regarding
as well as advice regarding her functional problems?
yes.
Can give some isometric back exercises, isometric abdomen exercises, pelvic tilting exercises.
Now, what other treatment means? Like for exercises, already they have talked in question number 6. So other than exercises, what are the advices you will give?
Postural correction,
Okay.
yeah, and then back care,
Okay.
massage and tense.
Hmm?
Can
Tense
give
and
massage.
okay, massage tense. You can also go for hot pack.
Okay.
Then question number 8.
Explain the care she should follow to reduce these problems. You can advise patient do's and don'ts. Like the
Related
do,
to back care.
yeah.
So question number 9 is explain SA joint maneuver. So you have 6 maneuvers. Especially you have 2 positions and 4 techniques. Okay, so you have to explain all the 6 maneuver here for the SA joint. Is that clear? Then what advice could you give to this patient with regard to her labor and immediate postnatal period? Means you can advise her to do the postnatal exercises immediately to reduce all these problems. So especially she has to concentrate on pelvic tilting, isometric back, then pelvic floor exercises that will help her to reduce the problem immediately after the postnatal time. Okay, so the 10th question is related to postnatal exercises. Okay, so is that clear, everybody? Any doubt in this question? So in your OSPE exam, so you will get a small case scenario with any one kind of question from this. Okay, so they may give the patient is having low back pain and she is in 37 weeks. What are the exercises you will give, or what are the advices you will give, like that. Okay, so a small part of this case scenario can be your OSCE question. Is it clear? So that's why I asked you to discuss about this question. So same question you can keep and you can practice the exercises. Is that clear? So that it is easy. It will be easy for your OSCE. So any doubt? So if no other doubt, then we will end up the class. So next class will be on Tuesday. So can we take 2 hours, because within 1 hour I find it very difficult to complete. Can we take 2 hours class? Next week, Tuesday. Is that okay? So that we can complete PNC next week. Are you all there? Are you hearing me? Okay. So what class you had already? Oh, you have pharmacology. I think like pharmacology class is completed, right? Okay. Okay. So you tell me if you are free. Otherwise, we will see later. Okay. Okay. Thank you.